Hi there. Welcome to Rassel Chiropractic's weekly newsletter. I'm Dr. Ian Rassel. A lot of patients come into the office and they're surprised to see so many children running around, babies getting adjusted, pregnant moms getting adjusted. This is something, for those of you that are not experienced in chiropractic, might seem out of the ordinary. So I want to communicate and clear the air about what we do with children and what we do with pregnant moms. Before we get started, I want to share a testimonial board. We have them all over the office, and I'm constantly reminded by patients on some of the miracles we see in chiropractic. And the miracles are not in anybody over the age of 8 years old. They're always so younger than that. This is a patient that came to me. It was actually the grandmother that brought the grandson in. It says, "A month after my grandson was born, I began to think he had some form of retardation or problem. We would try to get his attention, and he would just stare with no light in his eyes at all." I remember this young man coming in the office. Ivan had no light in his eyes, blurry, gray. It says, his head turned to one side at all times, and his feet pointed in one direction with hardly any movement. I want to thank Dr. Ian Rassel, because after the second adjustment, we started to notice a huge difference. Now I have a new grandson, young Ivan Rodriguez. We have these storyboards all over the office, and the purpose of us communicating chiropractic to thousands and millions is to understand and to tell people that, you know what, your child might have been injured during pregnancy, maybe childbirth, we don't know. But rather than wait 10, 15, 20 years for that child to have the first symptom, it'd be a whole lot easier if we check them at a young age. Now, you might see in my office a lot of pregnant moms coming in, and I'll tell you, pregnancy and chiropractic go hand in hand. Obviously, I'm never going to be pregnant and gain 20 to 50 pounds, but I do know this: if you put a whole bunch of weight on my abdomen, boy, it's going to put a strain on my spine, and if I'm not ready for that, if my body's not in shape for it, boy, I might have some problems. I might have some symptoms. So chiropractic in our office, the main goal for pregnant women is to get them relief, to make sure that the brain can send signals to little young Ivan while he's still in the womb, to make sure the mom's body is ready for this event. Pregnancy and chiropractic goes hand in hand, like I said. Oftentimes patients who are pregnant under chiropractic care have less complications during childbirth. They have a quicker delivery. I have time and time again husbands coming in and say, you know what, my wife got chiropractic care during our third child's pregnancy, and she was so much more enjoyable to be around. She was pain-free. She was able to move and walk and do all the things she wanted to do. So that's why oftentimes you'll see a lot of pregnant moms in our office. And in regards to the kids running around, we see lots of little kids. In fact, if you're ever here between 2:30 and 3 o'clock Monday, Wednesday, and Friday, you'll probably be swarmed by these little busy bees running around. The reason children get chiropractic care in our office is because their nervous systems can be injured too. I don't know about you, but I haven't fallen off a swing or a bike in a long time, but I sure know that my 6-year-old does it about every other day. And you better believe we check him on a regular basis, at least once a week. So children in our office, the purpose is not getting them out of pain. The purpose is to restore their nervous system how God designed them to. And it's so much easier to address these subluxations at a young age. Those of you that aren't sure what a subluxation are, it's just a big fancy term that describes when the bones in your spine, they get out of place. And when that happens, they can choke and pinch nerves. Now I'll ask you this: if I took the nerve from your brain to your heart and I choked it, you're going to be healthy or sick? That's right, you're going to be sick. And if we can unchoke it, you're going to be healthy. Well, the same is true from childbirth to 18 years old. Don't wait 10, 18 years for your first symptom. Get those little ones checked. Thank you. We'll see you next week.